Okay, good. So we'll call the East Lyme Board of Education special meeting to order for November 4th, 2020. This is a special meeting, and I will call the meeting to order. A couple of things right up front. Jeff and I thought that it would be best to defer the second item to our meeting on Monday, so this meeting is kept just focused on the one topic. I don't think anybody would object to that. We will have that discussion on the snow days on next Monday, so that would be good. And then the second point I'd like to say is to thank everybody for participating tonight. We're working overtime here as a board, and a lot of things have been going on, and I appreciate everybody's effort to make some time so that we can have a discussion this evening and get some more information on one item of East Lyme Public School 2021 continued school progress. So with that, Jeff, I'll turn it over to you, and you can set things up here.
Yeah, thank you, Tim. Appreciate it. I want to first start by thanking and introducing both Steve Mansfield, who's the Director of Health for Ledgelight, and Dr. Vijay Sakand, who's our medical advisor for the district, who we've worked with for a number of years. We appreciate both of them joining us this evening to really provide some further information regarding the discussion. We've had multiple discussions about hybrid, staying in hybrid, moving to full in person, the COVID cases and transmission, rates across, the state and the region. So I asked both of them to join us this evening just to kind of give their perspective, their update. You've seen my emails, I've corresponded with you, I've corresponded with a lot of different parents, but I wanted an opportunity for them to kind of share some thoughts as it pertains to, the hybrid, staying in hybrid versus moving out of hybrid at this point, given transmission rates. So maybe, Steve, I know you and Dr. Sakand are both busy. Maybe we could start with you, Steve. I know you're jumping between meetings, and then kind of give your perspective, if you don't mind, from the health department side of things.
Sure, I'd be happy to. Good evening, everyone. And first of all, my apologies for not making a proper Zoom presentation. I'm between meetings, and I'm actually in a parking lot on the side of the road. But I do have all my notes, so I should be able to proceed as I usually would. So first thing, the superintendent mentioned both Dr. Sakand and myself. I wanted to be clear that we have a lot of support, both locally and at the state level. So there's a whole cadre of epidemiologists and public health professionals at the State Department of Public Health and our partners at the Governor's Office and DECD and DOE who help to inform our recommendations and decisions. So just want to recognize there are a lot more folks involved. I happen to be one of the mouthpieces tonight, but the information is coming from the experts in public health. So that being said, I think we'll just jump right into the subject. Most of our municipalities are considering moving one way or another sometime in the future. Some are a little more I'd say enthusiastic about making a change. Others are less enthusiastic and really treading lightly. And I'll cut right to the chase and say that Ledgelight Health District and in my communications with all the superintendents, we are not recommending making any moves right now. And the primary reason behind that is the fact that things are going really, really well in our schools. Now, I have to explain that a little bit. Just because things are going really well in our schools doesn't mean we should move from what's working really well. I think the reason why it's working so well in East Lyme and other health district communities is the fact that there are policies and procedures and metrics in place that were carefully thought out and reviewed by multiple agencies, including Ledgelight, to give us the best assurance that the kids will be safe when they come to schools. I'll be the first one to say that I was skeptical. I was quoted by my wife as saying, the schools are likely going to be closed by the end of October. That was my public health and personal opinion. But I was proven wrong. I think it's a testament to all the work that the State Department of Education and our respective municipalities did to put in place these policies and procedures that work. So at a time when we're seeing the case rates in our communities grow, and in some communities exponentially, it just doesn't make any logical sense to move to a more in-person learning model at this time. It's, in my opinion, as a public health practitioner, it would be tempting fate. The things that are so important to helping to reduce the spread of COVID-19, social distancing is probably the biggest one in schools, would essentially not be able to be achieved should we go back to a full in-person learning model. I will mention, or I mentioned the fact that we have a lot of support up at DPH. Lynn Sosa, who you may know, she's one of I think she's the Deputy State Epidemiologist is her title. But on a conference call today, she actually said very clearly that if moving to a full in-person model will result in not being able to adhere to social distancing, then it shouldn't be considered while our community infections continue to increase. That's a paraphrase. It's not a direct quote. I was typing a direct quote, rather. I was typing quickly while she was speaking. But it's important to recognize that although things are going really, really well in the schools, that's not necessarily the case in our communities. And so by, in effect, doubling the amount of people who are in the school, or the amount of students that will be in the school, it will just put us in a position where we're no longer to maintain those critical minimum of 6-foot separation distances. And I think we would likely see an increase in cases if we were to do that. So my recommendation for the time being, and of course we review the data daily, and the data that comes out of DPH and the governor's office every Thursday, which has the new numbers that obviously it's measured in cases per 100. When that data comes out, we'll look at things and we'll reconsider. I think this is probably a good time to mention the fact that for those of you who may not have a background in biostatistics or epidemiology, the longer period of time we look at, the more stable the numbers will be. And also the bigger the numbers, the more stable they will be. So if, let's just say last week's release of data, which was based on the previous 2 weeks, put East Lyme, you're still in the area where a hybrid model is the recommendation, although it's trending to the left, which would indicate maybe consider an in-person learning model if it continues to go that way. So just keep in mind that data that's released is only a snapshot of 2 weeks of data in a relatively small community. So we want to look at a progression of data over time and then make a decision. Are we really trending up? Are we really trending down? And then perhaps consider recommendations about increasing certain aspects of occupancy and so forth. So that's a lot of information in a very short period of time. I'm sure it put a lot of questions into your head. So if there's anything I missed, I'll chime right back in, but I'm happy to stay on and answer anybody's questions as best I can.
You want, let's see, Dr. Secant, would you like to say a few words, and then we'll open it up for questions?
I actually had quite a few words to say, and I don't know whether, Steve, if you have to run off pretty soon and want to answer questions specifically to you so you can get to where you're going, I don't mind waiting and then speaking and then perhaps answering some questions if that's helpful to you.
That actually, I've got about another 10 minutes, 10 to 15 minutes. So either way is fine with me, Dr. Secant.
Well, okay, I'll try to keep it brief. I mean, I obviously had a lot of thoughts in my mind since this issue arose, but I think just briefly to begin with, let me just add to the common agenda that our shared goal in all of this is to get kids back into school full time. There's no question that is our goal, and that's what we're all working towards. And I think it's worth putting in perspective where we are today, because all of the organizations, CDC, American Academy of Pediatrics, everybody, they're all advising a layered approach to reopening of schools. And Jeff, you have followed that very well, in my opinion. since the beginning of this pandemic, or since we first saw it start. If I might just put it into total context, in March of this year, I was stranded in Mumbai, India, in an Airbnb trying to get home because of a lockdown, and my phone rang, and on the phone it said Jeff Newton, and I was 9.5 hours ahead in India, and I said, I wonder what he's calling about, and there you were saying you're closing down the schools, and you wanted to talk about it. I got back on a U.S. Embassy evacuation flight, and the day after I got back, Jeff was on the phone again. And to cut a long story short, we've talked pretty much every week since then, or communicated in one way or another every week. And along the way, you've gone from that total closing of schools and all virtual to this past summer. I was very happy to see the extended school year special needs children program operate for quite a few weeks during the summertime, full in person for those kids who are so much in need of that sort of education in classes. And then a couple of months ago, layering further on, you guided us into the hybrid model, which has worked so well till now, and we've all been following the numbers. And to echo Steve, let's not mess with what's working well when we are not certain about where the numbers are going in the weeks ahead, but we are monitoring it. So just as an introductory piece there, Jeff, you've done a great job in layering, and that is what is recommended for school reopening by all the authorities. Steve, thank you for those details from the epidemiological and public health point of view. Those data are critically important to what we're doing, and I thank you for providing those today. But I want to just also go on the record, if I can tangentially take an aside and thank you for the wonderful job you've done, not just for the district, but here in the town and for all the towns in your jurisdiction during the pandemic. You've always been available, accessible, personable, knowledgeable. And for that, I'm grateful. In this town, it wasn't until a few years ago, we had just a part-time local health director. And that was the model from years ago. And I'm so glad that Ledgelight took over the town, because with the pandemic presenting the issues that it does, we would have been totally unprepared had we not had the resources of your guidance, leadership, and staff over there at Ledgelight. You're doing a great job, especially helping us put out fires along the way, which were inevitably to occur.
Dr. Secan, I'd like to, if you could just hold some of your thoughts here. I'm very conscious of the time, and I think some of the board members have some questions that they would like to get Steve's input on. So if you could just hold for a second, and maybe we could open the floor for some questions. And I see Eric's got his hand up. So Eric, I'll give you the floor.
Thanks, and thanks, Steve, and thanks, Dr. Secan, for coming and talking to us. I think we all have a lot of questions and just want to understand and trying to sort through. There's no easy answers, at least, to what we're trying to do. One thing that would just help for me, Steve, is you talked about that things are going well, and I think it's from the perspective. I want to just clarify and then ask your opinion. So one is, I think that's from a COVID transmission and safety, and we're not seeing a lot of transmissions in the schools, so things are going well. But I think what we're trying to balance is that with the education of our students. What's the best way to educate our students? We want to keep them safe, and there's also the mental health of sitting in a room on Zoom calls all day is not great either. So we're trying to balance. There's almost like three pieces. There's COVID, there's education, and there's a mental health aspect. And I'd be interested in your thoughts on what's your opinion on balancing those things as, one, so I'll pause there and just get your comments. That's how I look at those three things and be interested in how you would balance those.
Sure, and yeah, those are absolutely great questions. So the first thing I'll say is, yes, when I stated on the record here that things were going really well, I was referring only to the rate of disease transmission in our respective school systems and the fact that the mitigation measures that have been put into place have worked really well to keep the numbers down. I didn't go into much detail, but I think it's probably interesting to know that, district-wide, and I don't mean East Lyme, my 10-town district, we've only had 9 cases of confirmed person-to-person transmission in our schools. We've had plenty of people who have tested positive in the schools, but they didn't acquire it. It was community-based acquisition, and then they just happened to go to school as part of their normal lives. So yes, there absolutely are more components to it than just the disease transmission component. But honestly, we don't have the bandwidth. We as public health practitioners don't have the bandwidth to get involved in the educational process and how well it works. I'm not an expert, and honestly, I don't have the time to focus on that part of this whole picture. So I honestly leave it up to the superintendents and the boards, the school boards, to consider what the imposition is on our communities when we put these in place and how they can best educate their students. So I would say I'm not an expert in that arena, and I don't have much information to share regarding the mental health status of the staff and the students in the schools. It's simply not my area of expertise.
Steve, can I just, Tim, let me just one follow-up. So thank you, and I appreciate that. You mentioned that there were 9 transmissions, I guess, student to student, or it could be faculty to student, whichever, and I don't need to know that, but within the schools, there were 9 transmissions. Were there cases where everyone was wearing a mask and it was transmitted in the school with everyone wearing a mask, or were there instances that it may have been transmitted during lunch or during other times where masks were not being worn?
So our contact tracing efforts don't really have the ability to get into that level of detail. So I'll just give you an example. If a student tests positive, we contact the student. If they are a good, what's considered a health historian, we speak to them directly. If we don't think, because of their age or some other issue, that they will be a good historian, then we speak to the teacher or the designated person in the school system to make that determination. And I'm sorry, I misspoke. I said 9. It was only 5 specific cases of in-school transmission. And I don't mind sharing. 2 of them were paraprofessional to paraprofessional. One was a paraprofessional to a student. One was a food service worker to 2 additional food service workers. And one was a student to paraprofessional. So there was only 1 student involved in all 5 of those transmissions. And our contact tracing efforts only identify the people who came in close contact with that infected individual. And then we put in place quarantine measures from the date of last contact to assure that they are excluded from school and other activities while they may be infectious. So we don't get into the minutia, if you will, of, well, where did they get it in the school? Who did they come in contact with? Other than identifying close contacts and trying to determine who we need to notify so we can break that cycle of transmission.
Thank you, Steve. I appreciate it. That's helpful.
Jamie.
Sure.
Hi, Steve. How are you?
Hi, Jamie.
So I have a question about this kid. And mine goes back to the kid's mental health. So Dr. Fauci said that this virus could be kicking around and having us on this weird scheduled path of pandemic, home, in school until like 2022, 2023. And I don't see us maintaining this.
Right. It's an untenable situation. It's an untenable forecast. I agree with you. And I'm sorry, I think I interrupted you before you asked your question.
No, that's okay. It's how are we supposed to maintain this hybrid learning for 2 to 3 years, because it's just not functioning well as it is for everybody's mental health and education value system. But how do we keep everyone healthy and educate them while fighting off a pandemic for the next 3 years?
Right. I think a lot of things are going to change. And I'll just give you a short historical example. When we first had the COVID pandemic and we put in place mitigation measures, they were, I'll say, pretty severe in Connecticut, pretty restrictive. And the numbers were relatively low, at least in southeastern Connecticut. They were really restrictive measures. Now our numbers are significantly higher than they were back when we put in place those really significant interventions, if you will, or mitigation measures. So this is kind of a rhetorical question, but why are we not doing that now when our case rate is so much higher? And I think the answer is that we've gotten to a point where we know much more about the disease, and I say we collectively, the governor's office is willing to make a decision that we're going to continue and be as normal as we can to try and restore that sense of normalcy, even though the case rates are high. Now, of course, we just did roll back from DECD sector rules 3 to 2, and that's, to some institutions, it's a significant rollback, but it's not nearly as drastic it wasn't in the beginning. So I agree with you. I think if we were just to continue on this path, there would be decisions made that would take into account the fact that, okay, this is the new normal and our kids have to be educated, and what's the best way to do that? And I don't like making projections or speculating when I don't really have enough data to back it up. But I think if it were to continue on, at some point the decision would be made, is this going to be the new normal? And do we have to return to business as usual as best we can and keep in place common sense measures to keep the protocols in place. So I absolutely think it's a moving target. And I think as we learn more, those mitigation strategies will change. I think it's safe to say that if we were to plateau right now at this rate, I don't think we're going to for some time now, but if we were to plateau after a period of time, I think that's when you have the conversation about, we've got to get back to normal. We've got to get back to educating our kids. And however that is able to be done is what we should do. So I think it would absolutely change. I do want to add that I have a 10-year-old and a 5-year-old in my household. So I know exactly what parents are going through.
Yeah.
Although I'm an uncle, I'm a dad too, but my daughter has grown and moved out. But the 2 kids that I'm responsible for, it's incredibly difficult for them. From an emotional, I'd say more than anything, an emotional standpoint, not being connected, there are a lot of negatives to not being in school 5 days a week, and they absolutely need to be considered.
So then I have a follow-up. One is, if I'm understanding you correctly, you're looking for some kind of rolling 4-week window of positive numbers for us to be able to go to the next stage of schooling?
Yeah, so the numbers are released every week from the Department of Public Health, and it's based on the previous 2 weeks of data. Okay. We used to look at data on a regional basis because, as I said earlier, we like to look at big numbers because they're more stable and their predictive value is much greater. But because there was such disparity in the numbers at the local level, DPH decided, rather than looking at a big population, say New London County, we'll do it at the town level, but we'll look at 2 weeks of data rather than 1 week of data, because that will essentially double the numbers, all things being equal. So every 2 weeks, every week the data is released based on the previous 2-week period. So after a certain amount of time, we'll be able to see which way this is trending. It's not going to happen in 2 weeks or 4 weeks. I would say things are unlikely to change from a policy standpoint until significantly into the new year, if the data tracks better. Now, of course, things could change. Absolutely, there could be policy decisions made at the DOE that come down to all the locals and say, this is what we're doing. This is our recommendation. We're changing the matrix based on the data, and that could be out the window. But what Jeff and I have to, and Dr. Secan have to work with now are the metrics that are in place and that DPH has given to us. And as everyone knows, what comes down from the state could change tomorrow, and then we'll have to obviously roll with that.
Okay, can I ask you another one? Do you have time or no?
I'd like to get a couple of other questions from some other folks.
Okay.
Bill, you've had your hand up, and then Candace.
Yeah, and just to be clear, this is Steve again. I texted my next meeting and told them I would be late and I'd get there when I can. So that's the way it happens these days. So I'm here for as long as you need me.
Okay, well, Bill, you're on mute.
We're going to do that. All right. Quickly, Steve, I don't know how in addition to being a board member here, I teach in a district that in Old Lyme where we are full in. I was curious as to how many schools that you oversee that are full in, and based on the data that you just shared earlier, essentially there's really no difference in cases. If it's only been one student to aid, then the risks, I guess, why do you see a difference for one group being full in and staying the same and another group not going to full in?
Great question, and I think I have a pretty good answer. So I've been speaking to Ian, the superintendent over at Old Lyme Consolidated, and since the beginning, we reviewed their plans just like we reviewed everyone else's plans, and we approved their plan moving forward because we didn't have a lot of guidance. We didn't have addendum 4. Well, we had it, but it was in its infancy. There wasn't a lot of guidance about what to do. So in Old Lyme, one thing that they have that East Lyme doesn't, and I haven't done a site inspection. This is all information that's been provided to me in plans or discussions, but they have a lot more room and they have a lot less kids. So they're able to have a full in-person learning model and still maintain that required separating distance for, as a mitigation measure to prevent the spread of COVID. So that's the biggest difference between just, using these 2 towns, East Lyme, 3 towns, East Lyme, Old Lyme, and Lyme. Less kids, a bigger facility, more room to do things. In East Lyme, if we're to go back to a full in-person learning model like they're doing at Old Lyme, it would be impossible to do that, impossible to maintain those separating distance and so forth. So that's the biggest difference between the two. Also, the rates of communicability in the population, community-based transmission in East Lyme is much more significant than Lyme and Old Lyme. So if you just look at the rates of illness calculated for those 2 towns, or even the raw numbers, there aren't many people in Lyme who've gotten COVID. That's the bottom line. And there aren't many people in Old Lyme who have gotten COVID. So those 2 things coupled together, the large facility and relatively small numbers of students, and the fact that their community-based transmission is significantly lower than East Lyme, paints the picture pretty well.
How does that play out with the other schools that are full in? I don't even know them, but there was rumors of some of the other larger schools that were full in as well. Is it a similar situation that they have more real estate and the towns have lower numbers as well?
I don't know. I only can speak for the 10 municipalities I'm responsible for. Again, I hate to keep saying this, but I've got to keep my blinders on to a certain extent because we burn the candle at both ends. And for instance, I know East Hartford, I think, is a full in-person model, and there are other communities across the state. I don't know what they do. I don't know what their facilities look like, and I don't know what went into their decisions to stay in or move to that full in-person model. I just simply don't know.
Thanks.
Okay, Candace?
Sure.
Hi, thank you so much. A lot of my questions, Eric actually asked quite a bit and so answered a little bit for me, and Bill also. So the goal for us, or at least for me, and I think generally all of us, is to try to integrate our kids back to more of an in-person model. And understandably, just by the information that you're giving us, it's clearly not the right time to do that. But what baby steps could we possibly take to try to engage more and bring our kids back even a little bit more? So I'm trying to find a balance of thought of how we can possibly do that. We in our district offer what is a Viking 4 program type of thing. Would it be realistic to try to offer more of a maybe a 4-day option for a certain amount of kids? Is that something that you would think would be realistic, or should we just, I'm just trying to get a baby step forward instead of staying stagnant.
Yeah, agreed. I understand. And I'll echo what Dr. Secan said. Our goal is to, Dr. Secan said, to get people back into as much of a full in-person model. And I will take it one step further and say, our goal is to keep kids as engaged as they are now. We don't want to go the other direction because we know that will be even worse than the situation we're in now. So I think it's very reasonable to consider what other steps you could take to increase the in-person learning model, as long as it's not detrimental to all of the mitigation measures that are already in place. So I'll share an idea that was shared with me today. It wasn't my idea. It was one of our superintendents called and said, and I'm not proposing this or saying it's an answer, but it's an idea. They asked about the possibility of opening up Wednesdays. The hybrid model is 2 on, Wednesdays off, 2 on, cohort 1 and Monday and Tuesday, cohort 2 and Thursday and Friday, actually having school in session on Wednesday and do the cleaning in the evening. Of course, there are personnel issues and collective bargaining issues perhaps, but doing their thorough cleaning in the evening, Tuesday evening into Wednesday morning, and then having, for instance, in week 1, cohort 1 would come back on Wednesday, and then in week 2, cohort 2 would come back on Wednesday. So it would alternate. Cohort 1 would have 3 days in session. Cohort 2 would have the following week 3 days in session. So I haven't, other than sending an email to DPH about the advisability of not having that 24-hour downtime on Wednesday, I haven't really looked into it much further, but that's an idea. I mean, it's something that could be considered that I don't think, in all my mental gymnastics, would have an adverse effect on the separating distances and would increase. I don't think it would be likely to increase the likelihood of disease transmission, because you're not increasing the footprint of students and staff, so to speak, in the school at one time. You're just opening it up for another day. So I'll just bring to the surface one question I have. There's something that's called passive decontamination, and it's what we use in, say, a restaurant, or we have the ability to recommend in a restaurant, if they have a positive employee, that they shut down for 24 hours. Basically, send everybody home, lock the doors, and don't go in the place. Just let it sit. And then virus dies when there's no activity. It settles, the air settles. So anyway, that's something that would need to be considered if you wanted to go down that model. But I know we could go on all night about the possibilities, but there are definitely possibilities that could be considered to take those baby steps you're recommending.
Okay, well, thank you for that, because I mean, we're all trying to get to the same goal, and we certainly don't want to make a step or a decision that's going to send us 20 steps back and or put anybody at a higher risk. But one of the, I think, well, there's quite a few things that we've acknowledged going into a hybrid model that it's lacking, and we're really trying to find the right balance for East Lyme. And in my mind, and I suggested a couple of times of just different ways of thinking out of the box and how we can try to get some more in-person learning, but just thinking of it differently, changing it up a little bit. So that was very helpful, and I'll continue on that task for now. Thank you.
You're welcome.
Barry or Lee, do you have any questions?
Bill already asked my big burning question for tonight, so I'm covered for right now.
Okay, good. Good. And I'll take it. Barry, questions? That's unusual.
Well, I do have some comments, but they're not so much questions. And because
Oh.
we're time limited here, I mean, very simply, I think a lot of the discussion is like the only option is to take the classroom model and put it online or basically make the classroom teacher student model prevail. The hope and optimism I have is that this pandemic is going to have us come out on the other side with an education system that's much more robust and much more effective than the one we have right now. And the only way we're going to get there is if we capitalize on the full potential of what online learning can be. And if we can capitalize on changing the role of the teacher-student interaction. But that's further down the road. So I don't see us basically vital to this model. It can work, but we have to really change the way we're doing things.
Okay, good. Thank you. Jamie, did you have another question?
Bill asked my question, so I'm good.
Okay, Bill, you got your hand up. Go ahead.
Yeah, I'm just trying to get all of this, make sure I fully understand all this stuff. And I just had a crazy thought pop into my head when Candace said, take baby steps. I have no medical expertise, but I'm thinking about first graders and kindergartners, and I'm thinking about their lung capacity, and I'm thinking about the 6-foot rule, which applies to adults. And I don't know enough about, talk about the volume of the room, et cetera. If we're talking about a bunch of little people breathing, can they be closer together because they're not producing as much of a volume? I also was talking about the fact that the teachers themselves are getting exposed. So really in my understanding, the risk is just if someone were positive, then the spread is likely to be greater because there's a greater number of people in the room. So I guess that's.
Yeah. No, I think that's another good example of a baby step. I've been speaking with the Ledyard superintendent. They've been, in their considerations, and they're not planning on moving forward with it now, but one of their ideas is to bring back, and I'm not sure the grades, I think they said K through 2, perhaps to full in-person. And their rationale is some of what you said, the fact that there is some science out there that they don't breathe as much and they don't produce as much toxin when they do breathe. And the fact that they're already, if kids that age, they're already climbing all over each other. It's really hard to keep those age groups apart now. So the fact that you'd bring them back and put them in closer proximity, it wouldn't be that much of a change than what is happening now. I can't vouch for that, saying that's true, but it makes logical sense to me. So I know, so Ledyard was considering that or is considering that at some point in time. Maybe the first thing they do is bring back the younger kids. So that idea definitely, I think, warrants some exploration.
PJ, did you want to make a comment?
See, this has to do with what we're talking about now, actually, from a medical point of view. I think it's worth bringing up because not everybody's aware of it. We've all talked about kids being less likely to have symptoms, less likely to spread it amongst themselves, et cetera, and less likely to be spreaders. However, the most recent data that are emerging indicate that there's actually a specific age that's now being assigned to that issue. And this might help in making one of those baby steps. They're now saying that children less than 10 years of age, I don't know if anybody else has seen the data or if you have, Steve, but children less than 10 years of age indeed are less likely to spread infection to others. However, data are emerging that children over 10 years of age are just as effective as adults at spreading, and there's this artificial, if you will, cutoff of 10 that's, I'm not sure exactly where that came from, but perhaps from the meta-analyses. But I think if we consider that in the decision-making and have some baby step, if you will, where the kids younger than 10 years of age or 10 or younger can be brought back in, knowing that there are good data showing that they are less likely to spread, less likely to get sick, less likely to have bad outcomes, et cetera, that may be worth adding to the equation.
Good, very good.
Yeah, I was not Yeah, I was not aware of that, Dr. Secan, but
It's-
yeah,
it's
that's
actually
definitely
in the,
something you'd want to look at.
In the, if you, it's not actually not so recent. It's even alluded to in the American Academy of Pediatrics on August 19th of this year, came out with its revised guidelines for reopening schools. And there's a blurb in there about it, but I've actually read other data which has been distilled from medical journals, from anecdotal reports and case reports, which support what I saw in that one paragraph in the American Academy of Pediatrics guidelines, which are 2 months old.
Right, understood.
Jeff, do you want to say anything?
I just want to add, personally speaking, in my head, I've kind of retargeted for, getting through the holidays, watching the numbers, obviously, but, and we've been talking internally some about, that January timeframe. I do not, and I don't think anybody wants to go, the full year without getting kids back in some capacity. That's been our goal. It was our goal at the start of the year, and we went hybrid, but we didn't know what we didn't know, So October 1, we were trying to get back in. We reassessed. It just wasn't the right time. But that's kind of my new target, is to get through the holidays. We've got some real breaks coming up, and with Thanksgiving and then the other holiday break, and shoot for January.
Good. Yeah, I think doing some planning around the ideas that have come out on the Candace's baby steps are right on, and we probably should be aggressively putting some things together to take those steps when it becomes appropriate. So that's really good.
Yeah, we're working on the logistics. Even though we put the brakes on now because we're targeting November 16th, we're still engaging in the logistics around those things. So when we're ready, we can pull the trigger and move forward.
Yep.
One
Other
thing I would
questions
like
from
to,
board members? Okay, Steve, well, DJ, I know, did you have anything else you wanted to share?
I think in the context, what I was going to share, actually, I'll save for another time because I like to keep us focused on the narrow agenda that we had today. And some of what I had to say is actually not exactly within that agenda item. So I'll put that aside and discuss that with yourself, Jeff, Steve, et cetera, in the days ahead.
Okay, that's good. Eric, did you have another question?
Yeah, I didn't know if, I thought we were then Dr. Secan was gonna talk, so I do have some questions.
I'm not leaving. I'm not going anywhere.
Okay, because I had some questions that might be more directed for him, but
Sure.
in terms of process, should I ask those now, or is there?
Does anybody have any more questions for Steve? So I think, Steve, if you're ready, we thank you very much for taking the time out and being able to be available. Very informative.
no, thank you very much. And Jeff has my cell phone number. It's out there, so feel free to ask Jeff if you think of anything else. And I do want to thank both the East Lyme School System and Dr. Secan. They've been great partners in this and working together. It's made it so much easier. And I can tell you across the state, not everyone is as lucky as I am to have, such good partners to work with every day. So feel free to reach out if you think of anything else, and I'm happy to do my best to help.
Thanks,
Okay.
Steve.
Thanks, Steve.
Thank
Appreciate
you.
Thank you, Steve.
Eric,
Thanks, everybody.
go ahead. Eric, you want the floor?
Sure. So I have two questions completely unrelated. So first is kind of a similar question that I asked Steve, and I'd be interested in your opinion of how you think about balancing COVID transmission, education, mental health, and how you would recommend and what your thoughts are on balancing that. And then, but my other question, when originally social distancing came out as a way to prevent the spread of COVID, it was pre the decision that everybody should be wearing masks, if you call some of the history, right? So the answer, well, get 6 feet away from everybody. And then we progressed to wearing that masks do actually help, and they may help protect more others from you, depending on the mask you're wearing and all that stuff. But let's just say it more protects others from you. But if everybody's wearing them, then we're all protecting each other. And but the social distancing piece didn't go away. So they're saying wear a mask and social distance, and that's still the CDC guidelines and stuff. But I'd be interested in your thoughts on if you're wearing a mask, if everybody is wearing a mask, and we do that in our schools, and then how much is 6 feet that important? I know 6 feet is a little bit of an arbitrary number, but let's just say, how important is 6 feet versus 3 feet or something like that? Can we increase the density if we do have good adherence to everybody wearing masks? So that's my first question. The second one is your thoughts on the education versus mental health versus COVID.
Let me just first address the latter part of your questioning. First of all, I agree with you 100% that 6 feet is arbitrary. And when you mention 3, it's interesting that you say that, because while CDC is quite consistent about 6 feet in its guidelines, the American Academy of Pediatrics, AAP, has a slightly different approach. Their approach is that 6 feet is recommended, but then the wording is, if not feasible, 3 feet. So it's interesting you also use the word, the number 3, because within the AAP guidelines, they actually frequently refer to 3 feet as being acceptable in their opinion. Although they also go out of their way to say their guidance is only meant to augment CDC guidelines, not to supplant them. But so there are folks out there who are reputable, smart people who suggest that 6 feet may not be the necessary number of feet for social distancing, especially if masks are worn. Now, that said, I think it's worth adding now the notion that it may not just be droplet spread in terms of communicating the disease. And we all know this is a very, very viciously contagious disease, second only to diseases like measles, for example. Not as bad as that, but it's far more contagious than influenza. So it is contagious. You need the mask, and as you said, to not spread it to others. But what may indeed be happening, but nobody's willing to hang their hat on it yet, is aerosol transmission. So if there is a significant amount of aerosol transmission, not speaking of droplet, but up in the air, which may take time to reach the ground, remain in the air for certain periods of time, et cetera, then the social distancing guidelines go out the window. And so, and the thing is, CDC does not acknowledge that yet. The WHO had experts who published significant data that in their opinion, it was a significant mode of transmission of COVID. So that's the second thing. The third thing is we still don't know, and this is tangential to the social distancing, but what about what we call fomites, or commonly touched physical items? Nobody knows for sure yet exactly how significant that is compared to the respiratory transmission. So there's so much uncertainty there. I think if we're going to be taking a baby step, for example, bringing back kids under age 10, or the littlest ones in elementary school, we would need to then perhaps confer with each other about maybe using the 3 feet guideline. And I'm certainly open to all of the above. Which I can use that to segue into your issue of mental health. What I'd like to share with you, if one of our colleagues can send me your email address, there's an excellent article, a couple of page long article from the Journal of the American Medical Association, which I think very, very in an insightful manner addressed the issue of mental health in children because of COVID-19. I'd like to share that with you. It addresses not only what's going on now, which we're all familiar with, but it also talks about the mental health repercussions years later, which I've not heard much talking about yet. But there's significant issues. I am very aware of them and also concerned about them. And in the best of times, in pre-COVID times, here in our region, not to mention elsewhere, there's a shortage of mental health professionals to begin with. And here we are in the pandemic. Not only are there not enough mental health professionals to take care of children available, but they themselves are constrained in their ability to provide those services because of the pandemic restrictions. In terms of meeting, there's a lot of telemedicine increasingly going on for sure. But so I have no solution for how we can mitigate the mental health issues at this point in time. If there are any out there, I'm ready to learn more and to advocate for that. But I don't see any way that we can immediately start to solve some of those mental health issues. Well, other than education, perhaps we can. These are baby steps mental health wise, but in communications with families, perhaps those of us most qualified to do so can start making families aware in terms that they can understand of the mental health issues which may be occurring in their children, and make them aware of it also, besides telling them what the signs of it might be, maybe suggesting some resources for mitigating that, encouraging them to reach out if any of those signs are there. To begin with, even before the pandemic, the second most highest cause of suicide in the age group of the up to 24 down to something like 10, 12 was suicide. The mental health issues, which we've always had, are being exacerbated now, for sure. But any way we can start to communicate with families about that, it's not just physical, it's not just the virus, it's also this. And even now, a lot of it has to be done remotely, I think is a good idea. If we can identify aggressively those within the school system who are most qualified to help promulgate those issues and to bring them out in the open, I think that would be a good step to take as well.
If I could just add to that, BJ, we just created an elementary survey, which we're planning on sending out. And an aspect of that is 1 or 2 questions pertaining to that social and emotional side. How are students doing? How are families and parents doing as well? As we're kind of asking those 2 questions. So maybe we can glean a little bit of data off of that as well.
Good. Okay, other questions, comments from board members? No? Okay. I think this was an extremely productive discussion, and Candace, thank you for the baby steps. I think that's a very good hit, and I think that we certainly should look forward to hearing some more thinking around this and more conversations with our superintendent and the administrative team as well. I think the point that people raise about the mental health situation too is really, really important. And that again ties into the having problems with not having enough teacher contact and not doing well in school and all the social activities as well. So it's a very tough situation. So, Candace, did you want to say something?
Yes, I just wanted to speak to the mental health part of it because it's a significant impact, and just with the lack of connection. And I keep going back to that because that's where it is. We're lacking the connection, and even just via Zoom. I mean, I've said it how many times. I love it when we're together, right? Because that's a huge impact. But from a teacher's perspective, just speaking to a few of the teachers through conferences, that's been one of the biggest obstacles, right? And for children also, because that's where they have that building block. It's where they find that foundation. And it's a relationship that starts right from the beginning. And it's just been impacted so much. And I don't think that some people don't, maybe they don't see it or they don't understand it. I think everybody's different and everybody's having their own experience family wise and through this whole entire pandemic. So there are families that have been hit by COVID and understand someone being sick and or having to deal with the loss of someone, and then their next door neighbor might be having a completely different scenario and experience. So it's kind of hard, but with hopefully trying to incorporate activities, whether or not they're Zoom or in person, safely, clearly, but the more normalcy that we can integrate in, it's not going to be perfect. And I know that. And it's very difficult for me just as I'm a triple type A personality, not just a single. So it's been very challenging. But for all, and in that little bit of normalcy that we can keep trying to integrate in and keep trying to think outside of the box of ways and hows we can do that. And it's exhausting, but please keep trying. I've been thinking of different ideas and ways that we might be able to increase in-person time for students, with their teachers, with other students. And we have to just find the right balance for us, for our community. So that's all I have.
Very good, very good. Kate, I see, yeah, Kate, please.
Hi, everyone. Couple of things. I'm just wondering if we could be more specific in terms of pretty much outlining steps and a plan and specific resources that we could put into place, because I really feel like parents are struggling. I hear from parents, teachers, nurses, students, and everybody is kind of in this conundrum, I guess, for lack of a better word. And we're all in it together, and it's not easy. But academically, I know that the kids are really struggling. And to some extent, I think that that's what parents talk about the most, of course. So my first question would be, is there something that we can do? And of course, this might be, as far as money is concerned, that would indicate that we could do to mitigate the spread. Do we need to improve, I guess this would be a Chris Lund kind of question. Do we need to improve air handling systems? Are there other things that we need to do as far as implementing more plexiglass? Are there things of that nature that need to be put into place that aren't currently in place? And I guess that would be, VJ, kind of more your bandwidth and kind of what you do. So additional measures that we could use to implement to handle the spread. And Jeff, I know you talked about a survey for the emotional component of parents. I'm wondering about staff as well too. How are they feeling? How can we do this? We just need to, excuse the Joe Biden kind of expression, but we need to build back better. We need to figure out how we can kind of all get through this for the greatest success for all of us. So I think we need to include a survey with staff. And I know that we have a lot of medical professionals who are also part of this conversation and dialogue. Perhaps we need to form some kind of a subcommittee or sub-team who could come together as far as some specific plans of putting together what it might look like, how it could look, some contingencies. And I like the idea of, kind of like midnight cleaning, if that would be possible, some late night cleaning so that we can have as much time on task and people present in the facilities to be able to have that opportunity for learning. And I know Amy talked immediately, Amy Drone, our assistant superintendent, about possibilities of really instituting better and more improved remote learning. And perhaps this is around the virtual Viking kind of component. Do we need to kind of up the bar on that? I'm afraid that eventually we can lose students to other districts where people might just decide they don't want to send our kids to Eastline Public Schools, where we've always been kind of a, blue ribbon premier. I mean, quite frankly, that's why my family 25 years ago chose to live in this part of Connecticut, was because of the schools and the reputation. So Those are some of my comments, and
Good.
if there's any response, I'd appreciate hearing what you
Yeah,
think.
and we appreciate it, Kate. I mean, and a lot of what you just said is in the logistical work that we're already doing, and engaging in, identifying, how much more PPE, plexiglass, we might need. Chrysaline is already, working on, on that aspect. I understand, districts have kind of handled, the hybrid model, differently. I'll say to, the parents that you're speaking to, the grass isn't always greener on the other side. I speak to superintendents every day around me, and they are getting the same high number of, issues, complaints, the same thing I'm dealing with and we're dealing with, they're getting, on their side too. So it's unfortunate, we need to get out of the hybrid mode or hybrid model eventually, and that's what we're working towards.
Good. Barry, did you put your hand up? Did you want to say something?
Yes, quickly. First, when I saw Kate come on, I didn't get a chance to thank you, Kate, yesterday for your sense of civic involvement and the discussion and the topics that you brought up through your whole campaign, I think have enriched our entire community. So I want to thank you for that and your civic involvement on that.
Thank you, Barry.
The second thing I wanted to, and just listen to the conversation, we were accepting the idea that the one form of instruction, which is to bring students, put them back in the classroom, in-person learning, is the optimal model. It may or may not be, and I would just think that if we could maybe amend our discussions going forward from the question of how do we set up in-person learning to the question of how do we best use all the resources to enhance students' learning.
Okay. Good. All right. Everybody else good? So I think this was a good discussion. Very nice that Steve Mansfield and Dr. Secant could join us with us. Jeff, any closing remarks from your vantage point?
No, I just appreciate Dr. Secant and Steve joining us, this evening and just sharing their perspective. Like
Okay.
I said, we've had a lot of conversations and we'll keep them going.
All right. So with that, I'll entertain a motion to adjourn.
Ooh, I'd like to make a motion to adjourn.
I'll second.
Okay. All right. All those in favor, signify by saying aye.
Bye.
We are adjourned.